Sure. Good morning. Thank you, everyone, for joining us this morning. We really appreciate it when we're able to do these sort of joint press availability. It makes our lives and the work of the public health response a lot more doable by doing so. So I just wanted to say that by start off by thanking you for that. I'm going to share a couple of things with you, and I'm going to be sharing my screen just so that I can walk you through what we are seeing and how we are thinking about it. So let me do that now. And as always, what I will share with you will be from publicly available sources, so that you can sort of go back and cite those as needed. But this is from the ADHS website, and I want to share with you a couple of things. So if you look at what's been going on with our cases across the state and across the nation, we look like we have peaked in terms of Omicron here in Pima County, and I base that on a couple of things. Here is the number of cases in Pima County, and I base it on a couple of things. I base it on the fact that for a couple of weeks now, I need you to see the rest of this. So for a couple of weeks now, we have had, we are starting to see the first sign of a decrement in the number of new cases. I also want to point out the fact that the maximum number of cases was a historic high that we had the week of January 9th, where we more than doubled our previous case count that we had last winter. And so that was very significant, very consequential, and reflective of the fact that really the Omicron virus is highly transmissible and has moved through this community very, very rapidly. One of the things that you're seeing across the country is that some of that as it moves across the country, it also sort of, you start seeing rates going down relatively quickly, and you see that even more so in communities that are relatively highly vaccinated, like our own here. So I think that is a bit of good news to share with you. The other piece that I will share with you, which I think is really important, is in terms of the amount of testing that has been occurring across this county and across this community. We continue to be doing really well by that metric. And again, from the state website, looking just at Pima County, I'll point out a couple of things and giving you a week by week view. I'll point out a couple of things that again, we have had historic levels of testing in the last few weeks, in the last 3 weeks or so, that are appropriate and concordant with the amount of disease that we are finding in this community. The other thing is that for the first time, we started to see a little bit of a signal of perhaps a decrease in the positivity rate. I'm not ready to say that our positivity rate is decreasing, but it looks like it may be topping out. So I think that's also a good sign that we're making progress in the right way in terms of our testing strategy. I'm going to share with you another piece, if I can do that up here. Oops. Wrong one. And so this is from the CDC COVID data tracker. Because again, my goal is always to give you something that is publicly available data sources that you can then mine however you want to. And if you click on Pima County here, I'm going to share with you a couple of things. First of all, note that the entire country is still pretty much at a level of high transmission, with a few notable random exceptions. You see these random counties in Texas and in other locations that are doing a little bit better, and so good for them. Pima County is still in a state of substantial transmission. Remember that substantial transmission was defined by the Centers for Disease Control as greater than 100 cases per 100,000 population. Obviously, we are in excess of that. Just in the last 7 days, for instance, there were 138,000 cases. 17,000 cases for Pima County. So that puts us, well above that level. But I'm going to share with you some pieces that I think are also really important for you to know and to share. First of all, if you will take a look at the proportion, at the number of people who are vaccinated in Pima County and the number of people who have received both doses, so are fully vaccinated in Pima County, we have reached 65.8%, and that level of vaccination is actually continues to be better than the rest of the country, better than the rest of the state, and in fact better than many countries. Sometimes when I'm bored, I look at the Hopkins website to look at where we would be if we were a country, and we would be in some fairly good company in terms of that. What I think is most consequential and what doesn't get enough attention, and it's because the feds have been really focused on the vaccination rate of folks who are 18 years and older, which we do just fine on that, is really the vaccination of any vaccine eligible person. And so given that vaccine eligibility has been dropped down to 5, what really matters, what you guys should really sort of be focusing on is what is the percentage of the population that is able to get a vaccine and that has been vaccinated. And there it is 69.5% of folks who are greater than or equal to 5 years of age have received 2 complete doses of vaccine or have received a single dose of Johnson & Johnson. That is pretty amazing, 69.5, and that is a pretty amazing figure, and I think that is really a sign of some really good progress. The other thing that I will share with you, that per the feds, our level of boosters is again moving along very nicely. 40% of fully vaccinated individuals have been boosted. Clearly, that is not enough. But I think it is, given when boosters first became available, I think that is a really sort of positive story to tell. The last thing I will share with you from this stuff is that last I checked, we had delivered over 1.7, almost $1.8 million. 1.8 million doses, and I'm going to just show you where you can find that data, had been administered to Pima County residents. And again, this is from the state's website. Sort of zeroing in the number of doses that had been received by Pima County residents is 1.724 million. So again, a pretty staggering achievement when you think about the fact that we have been at this for about a year. So I think that is what I wanted to share with you. I'm going to stop sharing my screen, and I know that there are questions, so I'm happy to chat with you about those.
Thanks, Garcia. We'll start with Mackler from Star, and Craig Smith from K-Gun will be up number 2.
Hi, good morning, Dr. Garcia. Thank you for your time this morning. Patty with the Star. Can you talk a little bit about how things are going with the schools and take-home tests for students who have been who are sick or positive and need to test to come back to school? Do we have enough tests for the schools right now?
Patty, it's a complicated question from a couple of standpoints, right? So not that long ago, 3 weeks ago, the January 15th, the week of January 15th, the federal government announced that it was going to be shipping out tests to every home that wanted them. I hope all of you, by the way, have gone to the covidtest.gov website and ordered your 4 complimentary tests for yourselves. That has created a lot of those are the very same tests that are being used in a lot of different environments. They're being used in our test environments, that are being used in schools, and that are being used in everywhere else. So there is a lot of demand for those tests, and the federal government has sequestered a lot of that supply. And yes, we are continuing to provide supplies to the schools and school districts. In fact, they are our priority when it comes to the tests that we have, both the self-administered, Patty, as well as the point of care. So those are the ones that have to be supervised by someone and are actually the ones that are also reported up to the state. So our priority as the county has been to supply our school district partners and our schools with it to with every single test that we've had, we have tried to put it in those hands. Do we have more demand than we have tests today? Absolutely. One of the things that was announced last week was that certain school districts, the federal government would start shipping directly to certain school districts across the country. The first 2 school districts that are scheduled to receive testing or tests from resources from the federal government are Sunnyside and Tucson Unified School Districts, appropriately. And there should be more tests that are coming to them. So bottom line is, yes, there's a lot of demand. Yes, we are intermittently at points where we have very low supply to share. Yes, there is a lot of new supply in the pipeline that from the federal government as well as from the state, and we are endeavoring to make that as possible. That's also, Patty, part of the reason why it made sense to expand our testing capacity within the county. That is the kind of testing that we're paying for ourselves directly. Is exactly to do that. You know that we have the FEMA testing site and an augmented paradigm test site that are up and fully operational, and that I think will meet a really significant need. I will take the next question.
That will be from Craig Smith, and Eric, KVOA, is after that.
Hi, Doctor. Thanks for taking some time for us. Now we're hearing about a new subvariant of Omicron out there. Is there anything that public health people can do to prepare for new variants when they haven't quite emerged and you don't even know exactly what their qualities are going to be? And is there also sort of a psychological impact of these? I mean, after people got beat up by Delta, then Omicron appeared, and you started hearing people kind of take the attitude of, oh, what's the use? I mean, what can you do about that?
So, Craig, you bring up a really important thing that is important to share, and that is that the nature of viruses is that they change and they evolve and they mutate. And we've known this. This isn't rocket science. This is not news. This has been the case for we see it every year during the flu season. We see it every year, and we know that this happens. I think that. So you asked a very concrete question, which is what can we do to be prepared? What we can do to be prepared is be as vaccinated as possible, because it is clear that if you don't have a susceptible population, a new variant doesn't take hold in a community unless you have a susceptible population. So if our population is as well vaccinated as it can be, and even though I shared with you that I think that we've made some substantial and very exciting progress in our vaccination rate, we are not at the point where the pool of susceptibles is so small that there can't be that they're not available for the entry of new variants. I think the other piece, and you forgot the Alpha variant, which hit us, and then the Delta variant, which hit us hard, and ultimately the Omicron, which has numerically been very significant, but has been a little bit easier to manage. I think that you're right that people do start to get fatigued. I think we need to set the expectation that this is the nature of viruses, that viruses evolve in order to continue to perpetuate themselves, and that the best thing that we can do to mitigate against that, to minimize that, is to be as vaccinated as we can as a community. I'll take the next question.
Eric Fink from KBOA and Ariana Garcilazo from Azteca Tucson will be after that.
Hey, Dr. Garcia, thank you so much for taking the time. Appreciate it. Can you explain a little bit more? I know you started off by saying you believe Pima County has hit the peak. Can you kind of explain a little bit more about that, and when you think hospitalizations may start to dwindle as well?
So I shared with you that graphic that is available on the ADHS website. I will feel a greater degree of confidence, Eric, when next week when we have another week's worth of data. But to me, the indicators are in the right direction as I'm seeing it play out in other counties, as I'm seeing it play out in other parts of the country. That is where my belief comes from. Now, to be really, really super clear, the impact on hospitals continues to be very, very devastating and will continue to be the case. Remember that the person who gets infected today, who is, say, immunocompromised, who's older, who gets infected today, starts developing symptoms, starts really having medical issues. That's not going to happen for a week or a week plus down the line. They don't turn into ICU admissions at the moment that their test is positive. They turn into ICU admissions a good week to 10 days to sometimes even 2 weeks after that happens, depending on how healthy they are. So we have not, if we have peaked, and perhaps I shouldn't have used that language, if we have reached a sort of a high water mark in terms of the number of cases, we have not reached a high water mark in terms of the number of hospitalizations or intensive care unit visits. We have still had days in the last week where we only had 2 or 3 ICU beds available in this county. So we won't see that impact for a while. The same thing with mortality, although the impact of mortality is even further down, right? So you get infected, you become really sick, you end up in the hospital, you end up in an ICU, and for some folks, they don't leave that ICU. So the impact of mortality we will see more like 4 weeks out there into the future. So I believe that we still need to watch those numbers very carefully. I'll take the next question.
Ariana from Azteca Tucson, and then we'll go back to Patty Mackler from the Star.
Buenos días, doctor.
Buenos días.
Mi pregunta es sobre la recomendación de la CDC a que personas pueden regresar a trabajar o a la escuela después de 5 días. ¿Es posible que estas personas todavía tengan el virus y está de acuerdo con esta recomendación?
Mire, la Agencia de Control de Enfermedad, CDC, ha estado cambiando sus pautas, ¿verdad? Lo que nos recomiendan acerca de cuándo debemos de quedarnos en casa. Eso en realidad a veces nos causa algunos problemas. La recomendación más reciente, o sea que se puede volver al lugar de empleo después de 5 días, si es que no se tiene ningún síntoma, o sea, no se puede tener calentura ni ningún otro síntoma, en ese momento se puede volver al lugar de empleo. Eso es lo que están recomendando. Lo están recomendando porque es más factible que una persona se acople a esos 5 días en contradistinción a los 10 días. So just to share with you what I shared with Ariana, her question was about the evolving isolation and quarantine guidance that's coming from the Centers for Disease Control. Realize that when the Centers for Disease Control does this, they are sort of weighing a mix of both science as well as sort of practicality of their recommendations. The most recent recommendations have caused some people consternation because they suggest that after 5 days after a positive test, if you are completely asymptomatic and meet all these other criteria, you may return to work. And so it's an evolving area, and we continue to rely on the Centers for Disease Control to provide this larger picture guidance, understanding that each of us as employers, each of us as individuals at the work site have to make some tough decisions on our own. And sometimes those decisions involve, staying home. So I will leave it at that, and I will go to the next question.
Okay, Patty from the Daily Star, and then Craig Smith again from KGUN.
So I'm trying to think of how to phrase this question, but we keep hearing about the hospitals and the number of ICU beds that we have available, staff available for those beds, and it seems, in doing stories about it, it becomes repetitious. And I don't think that people in the public understand the magnitude of what's happening in the hospitals. Can you share what you hear from hospitals that, maybe administration or people that would help people better understand the extent of what is happening in our hospitals right now?
Patty, it's such an important issue that you're bringing up because I think that to a certain extent, as a population, we've become deaf to some of these things. And it makes sense, right? We've been doing this for 2 years now. The 26th of January of 2020 was when we first stood up our virtual EOC in response to the first case in Maricopa County. Subsequently, 2 months later, on March 4th, we had our first case here in Pima County. So we've been at this for a very long time. I'll tell you that when I talk to the CEOs, the chief operating officers, the chief medical officers at our hospitals, I tell you that their teams are stressed, their teams are stretched, their teams are fatigued. And this is all within the context of a very tight labor market. They are having to compete for nursing and with states that are offering very, 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 very generous compensation packages for our nurses. They are having to do this in the middle of this very, very dramatic surge in the number of cases, which then causes their own kind of, infection control issues, i.e., the Omicron impacts their staff as well as it impacts any of our other, teams of people. So you see record numbers of call-outs at our large hospitals, and people who can't be available for work precisely because they are positive or symptomatic, et cetera. So the way that I always try to sort of contextualize it is and the reason that ICU beds matter and the reason that hospital capacity matters is that we live in a world, our lives haven't stopped, and we live in a world where we continuously face some degree of risk. And I often talk about the God forbid, a school bus get hit or some mass casualty situation emerge. In those situations, that ICU bed inavailability means that those children, those people have to be transported out of county and perhaps even out of state. And to me, that's the way that I talk about it. But you are right. Everybody's tired and everybody's fatigued. I'll take the next question.
Okay, we have about 5 minutes left, and right now we have Craig Smith, who's next, and then Eric Fink, and that's the other two in the queue at the moment.
Doctor, when we're hearing about the hospitals sort of loosening their quarantine rules for their own staffs because of their staff shortages and such, does that concern you at all that the staffs themselves could be sources of further infection?
Craig, so the reason we did, and remember, this isn't new. We did this early on. Last January. The same occurred, right? When staffing is tight, you have to make sure that you have the number of people available to care for the folks who are in your institution. I have a great degree of confidence in our hospitals, in that they are making sure that people who are coming back to work are not symptomatic, right? And because those are the folks, and the folks that are that it's really soon, like the next day after a positive test, where you're shedding a lot of virus. I know that our hospitals are not allowing that to happen. So yes, it does introduce a little bit of risk that has to be weighed against the patient care needs. Those risks are offset by very stringent wellness requirements of their employees, as well as masking and PPE requirements of their own employees, so that it does not cause a danger to the patients that are in their care. And this is what happens. This kind of loosening is exactly what happens when our hospitals are overwhelmed. I'll take the next question.
Okay, I think we'll wrap up with Eric Fink.
Doctor, thanks. Earlier in the week, TUSD had, I believe, 354 teachers out with COVID or close contact with COVID. Teachers were having to obviously cover for those who are absent. Do you favor individual schools to go back to remote learning if need be? I know, perhaps not the greatest environment for kids and for families, but where are you on that as COVID continues to hit our schools hard?
Eric, it's a really good question, right? But I'm a public health professional. I'm a gynecologist. I'm not an educator. Those decisions about when and how and under what circumstances to move into a remote or virtual learning environment are really best made at the level of the school district, or really best made at the level of the school. We all have kind of roles to play. We all talk to each other a lot. I will tell you, the superintendents and the principals are in contact with our team, and we talk an awful lot with each other. But each of us kind of has a very distinct role to play in this, and I really think that educators and educational administrators are the best ones to make those calls. I will tell you that sometimes they have to make decisions for very practical, pragmatic reasons. If there's not sufficient staffing, I remember relatively early on in the school year where a school district, because all their janitors were out with COVID, had to shut down one of their schools. That was a decision that was appropriately made by our school district colleagues, and that is the right place for that decision to be made. I will take the next question.
We have no other questions. It's 9:30, so I think you're free to go. Thank you, Dr. Garcia. For the rest of the media, many of you have, but if you want a recording, please leave your email in the chat and we'll get that out to you. Otherwise, thanks everyone. Have a great day.
Thank you all.
Thank you.